So we have a patient who presents with orthopnea, agitation, cyanosis, hypertension, and crackles. What is likely the condition? Would you say it's A, left ventricular failure, B, right ventricular failure, C, acute myocardial infarction, or D, cardiogenic shock? Now, I think we can all agree that this is an EMT type question, but at the same time, if you don't know medical terminology, this will really mess you up, right? Orthopnea means that your patient has shortness of breath depending on the position in which they're laying or sitting, right? So typically, these patients, if they lay flat, they feel like they're drowning or they get really short of breath and they kind of freak out. So you have to sit them up, high Fowlers, right? This patient also has cyanosis, so they have a changing in color in their skin due to hypoxia, hypertension, high blood pressure, and crackles, which is fluid in the lungs. This sounds a lot like CHF or congestive heart failure, which is a sign of left ventricular failure. Remember, with right ventricular failure, this patient would have more pedal edema, hepatomegaly, so enlarged liver or enlargement of other organs. They would have more of a systemic backing up of pressure versus with a left sided heart failure, this blood gets backed up into the lungs and into the alveoli, hence why this patient will have more pink, frothy sputum. And believe it or not, these patients are more likely to have hypertension than hypotension. If this patient was to have hypotension in this test question, then the best answer would have been D, cardiogenic shock. This is what I tell students all the time. Cardiogenic shock on exams, or honestly in real life, is a CHF patient with a low blood pressure. So look out for that. And then obviously acute myocardial infarction is also known as a heart attack. Nothing in this test question pointed us towards a gradual onset of chest pain or anything like that. So again, A, best answer, LVF, also known as left ventricular failure.